Good morning, and thank you for joining IHC's Small Employer Cost Savings discussion. This will be an approximately 35-minute webinar. My name is Tim Mulvihill. I'm Vice President of Group Products for IHC. We find ourselves in some very interesting times right now. I've been in the small group insurance segment for 25 years, and I've seen several complete cycles. I've also been a small business owner myself. I have never seen a market reverse speed at the pace that we've seen here recently. Think about it, just 4 weeks ago, small business owners were talking to us about things such as growth and expansion planning, being challenged with talent acquisition and retention, and even willing to pay a premium to buy national brand benefits. This week, they're talking about keeping their heads above water, keeping their employees' heads above water, and simply looking for any solution they can find. At IHC, we believe we have unique, flexible products to help solve many of your customers' challenges that they face today and that of prospects that you have. We also have a team of experts to help you guide you through this. Think of them not just as company reps, but as your consultant. They are not just here to provide quotes, but they're here to provide insight for you. This morning, John Williamson and Kim Carboni are going to walk you through our products and show you how our most successful brokers are using them. Kim, would you like to get started for us?
Yes, thank you. Good morning, everyone. I'm going to be monitoring the questions box that you have access to. So please, if you have questions, go ahead and type them out. We'll address all the questions at the end of the webinar. But please reference the product that your question pertains to so we can answer it correctly and precisely. And with that, John, I'll give it to you to take off.
Well, thank you again, everybody. Good morning. We really appreciate you guys taking some time out of your day to attend some education about IHC's small group products. We believe that your employers can be really well served by some of our creative solutions, and we're looking forward to educating you guys today. So IHC has been in the insurance business for about 40 years, and we offer a full suite of group products ranging from our small group self-funded product to products like Group Gap and Evolution that we can build in to our medical plan, but also any other plan out there. We also have things like standalone dental and life and disability products. With the current economic environment, a lot of our producers are looking for a great solution for employers facing diminishing sales, evolving enrollment and payment issues, as well as an opportunity to retain their employees during this time. The small group self-funded product that we offer is called Simplified Funding Concepts. This is an ACA compliant product available for the 5 to 75 enrolled market. Recently, we expanded our eligibility from the 10 to 50 group size, and we're excited about the new opportunities that we can pursue, especially in that 5 to 9 group space. This product is individually underwritten, and our applications are available on FormFire and Easy Apps Online. We are underwritten by Westport Insurance Company, wholly owned by Swiss Re, and they are a very well-known name in traditional and large group stop-loss circles. So a lot of people that may not have been exposed to a level-funded or partially self-funded product may be wondering, why should we be looking at a product like this? What's the main reason why we should be offering this to our clients? And the main reason right now is this is a fantastic alternative to those fully insured group ACA plans. You guys have seen the rates. You've seen the, an employee-only premium of, $750. This is an opportunity for you to show your employers that you can save money, you can retain a high level of benefits. And by being able to individually underwrite cases, we're able to see potential savings, anywhere from 15 to 25, 30% over fully insured plans in many areas. Obviously, being an underwritten product, this means this is not a fit for every group, but it does present a really interesting alternative to explore. The product is structured in a way that we are still offering a consistent level of benefits in terms of covered services while offering the potential to get money back. Also, it's extremely important to keep in mind that outside of the fixed premiums, there's no additional risk to the employer. We're not going to come back mid-year and ask for additional funds from the employer if there's not enough money in the claims fund to meet claims for that particular month. the stop loss and claims funding mechanisms that we have built into the plan on the backside ensure full coverage.
John, can you go into explaining the refund of that claim fund?
Yeah, absolutely. So with our small group self-funded product, we do return 100% of any remaining claims funding after the runout period. And by realizing these potential refunds, we can get employers out of the mindset that their healthcare plan is truly a 12-month process and concept. We need to get employers to think of group health insurance as more of a 3 to 5 year program. And by bundling this with some of our other options, like our group gap plan, like our bundled accident and CI products, we're able to really take that 3 to 5 year concept to the next level. And lastly, we offer further cost savings options to employers by providing multiple network options, including a full reference-based pricing option. Now, everything we've told you guys sounds great, but some of you might be wondering, okay, how exactly does this level funded product work? And each month, the employer is going to be billed for the full premium amount. If there are any additions or terms mid-year, we adjust the premium by that composite rate only. If we add an employee only, then we're going to add that employee only premium. If we terminate a family off the plan, we're going to remove that family premium. So we're not re-underwriting the group mid-year if someone comes or goes. And once we get that full premium in-house, we divide that up into 3 parts: your claims funding, your stop loss premium, and your administrative costs. So if an employer has claims in excess of the spec per person or the aggregate claims funding, the stop loss carrier is going to make accommodations to the employer's claims fund to make sure their account is whole. So again, we're not going to come back mid-year and ask for more money. There's no additional risk beyond the employer's premium for that month. So when we do get claims, we process claims incurred in the 12-month policy period, and we also provide a 12-month runout period to help cover claims incurred but not yet submitted. And keep in mind, at the end of that runout period, we do return 100% of unused claims funding back to the group.
Now, John, do you only refund the claim fund if the employer renews with us?
So we do refund 100% of the unused claims funding, whether or not you renew. So we do realize that there are some instances where you might get a heavy renewal and you do find a better option out there. We're not going to penalize the employer and keep a portion of their money.
A great example I can share with you all is that just recently I had a 23 life case up in Wyoming that finished their run out January 1st and received a $34,000 refund based on that excess claim fund that was left over.
And that's a perfect example of how we can look at this as a multiple year program. They're able to take that refund and apply that to additional benefits or possibly back to the TPA in the form of a check and see that premium the next month either eliminated or potentially reduced. So in terms of state availability, Simplified Funding Concepts is available in 23 states, and we're currently evaluating additional states at this time.
Breaking news just in, John, we are launching in Oklahoma and Nebraska within the next 30 to 60 days for quoting.
Awesome. That's 2 additional states right in the heartland of the country that we should be able to help these employer groups out. So discussing plan options and actual plan design, members are going to see that this is very similar to fully insured coverage. They're still going to have their office visit copays, they're still going to have prescription benefits, and they're still going to be able to pick a variety of deductible options, anywhere from $1,300 all the way up to $7,900 if they want to maximize their cost and potentially look at some additional products. And one thing that I do love to point out is that if a group elects an office visit copay on our Simplified Funding Concepts product, we will cover the first $500 of outpatient diagnostic lab and x-ray per day at no cost to the member. It's going to be paid completely by the plan. So this is a huge cost savings benefit to the individual members. That's a lot of things, outside of going to the doctor, getting prescriptions, those outpatient services, those are, very high cost items that see a ton of frequency. Being able to cover the first $500 is a huge benefit. And the last thing I want to make everybody aware of is that our emergency room services apply to deductible coinsurance. There's no copay or access fee. Other companies do apply emergency room services to the deductible and coinsurance, but a lot of times they've got, a $250 or a $500 access fee added on top of that. So part of the reason we do that is we have a very, very aggressively cost urgent care copay. It's $50, and that is $50 across the board, no matter if you pick the $20 office visit, $30, $40, it's $50 across the board.
John, I was speaking to one of my biggest producers earlier this week, and the conversation came back to a few months ago, employers would pay 10, 20, even 30% more to be with a marquee carrier because of name recognition, not wanting to change. She said her phone is ringing off the hook because now her employers are saying, help me, how do I save 10, 20, 30%? So we have the ability now to be creative, work with our agents who can work with their employers to be able to show them some cost savings. With that being said, this is a product that does need a year guarantee. So if you have a group that kind of fluctuates in employment, they don't know if they're going to be able to keep the doors open, this is not for them. So we really need a group that's committed to a year to continue on a self-funded program.
Perfect. So the next product that I want to introduce to you today is our group gap product. This is a product for groups of 2 and above of any group size, and it is guarantee issue. So as we discussed with our SFC product, Simplified Funding Concepts, we want to start getting employers to think of their benefits in this 3 to 5 year concept. And one of the great ways to do that is to start incorporating group gap benefits in as a cost containment measure in order to keep the total out-of-pocket expense for the members consistent. And the point of this product is, again, we want to lower the out-of-pocket, lower the cost. So there's 3 ways that this product is beneficial to your employers. So the first thing is we want to keep the out-of-pocket expense lower while keeping the overall premium the same. The second option is we want to keep the out-of-pocket expense the same while seeing a lower cost overall. And then lastly, what we try and do on every plan is come up with a formula that will give us lower out-of-pocket expenses and a lower overall premium once we combine the medical and the gap premiums together. So with this product, again, we can go down to as low as 2 enrolled, and our eligibility is based on those participating on the group medical plan only. Rates are driven by employer contribution, so the more the employer contributes, the better your rates are going to be. And again, we can add this to our SFC product or any other carrier out there. This does not need to be bundled with our group medical plan to be sold. So through our plan designs, we can provide first dollar benefits, or if we're looking to save even more money, we can add a deductible onto the group gap plan to help reduce cost further.
John, when you're quoting link, can you show that next to our self-funded plans to show how the product really does work?
Absolutely. And in our proposals, we incorporate all of this together. So on one page, you're able to view our medical quotes, and on the next page, you're able to view our group gap benefits. So this is a great thing for you guys to have side by side. And to my knowledge, we're the only carrier doing both group gap and medical benefits. So that gives us a huge advantage when trying to explain this concept. And it helps you guys out as well. So you're not going to have to constantly go back to another carrier, get us some higher deductible options, higher out-of-pocket options. We can send that to you all in one proposal. Currently, Link is available in 41 states. And compared to our self-funded product, we've got about 18 additional states where this group gap product is available. And this can really help you out when you're working in multiple states. I'll give you an example. In Cincinnati, Ohio, it's right there on the river. We have a lot of agents in that area that do work in Kentucky. Unfortunately, our small group self-funded product is not available in Kentucky, but by being able to package this product with our plans or any other ACA approved plan out there, we're able to expand our footprint and help these agents in multiple states. The way the product works is by paying our group gap benefits up to either the full benefit amount for covered services through the plan or the billed amount if it's not going to maximize the full benefit. So this slide is going to show some of our most common covered benefits that are payable by the plan in terms of inpatient and outpatient services. Keep in mind, we're only paying the member responsibility as part of the medical plan. So if a claim is $1,000, we would only pay the $1,000 depending on how large the group gap benefit is and how much we've already paid out. If a member is not responsible for charges through the medical plan, gap plan is not going to pay out those benefits. This page here will highlight some of the more important things that come up when you're discussing group gap with an employer group. So pregnancy is actually included in all of our IHC proposals as a standardized benefit, and we do have options to add prescription and office visit benefits. Some states will mandate, like Ohio, both pregnancy and mental, nervous, and substance abuse. And for those states that don't require mental, nervous, substance abuse benefits, we do have an option to add those to your quote.
And to add that mental nervous benefit, it is about a 5% increase of the premium. I also wanted to ask you, who's buying these plans, John? And who's eligible for them?
Yeah, absolutely. So again, this is eligible to employers that have a fully insured or self-funded plan that is ACA compliant. And employees are eligible again if they and their dependents participate on the medical plan. So for example, if someone's on the medical plan as an employee only, but they do have a spouse and dependent kids, they're not going to be able to enroll as a family on the group gap plan.
And how is the flexibility with this plan, John?
So we do have some flexibility in terms of plan design, and we are able to offer things like a dual option. You know, we can offer a group gap plan to just one plan out of the dual option. You know, let's say we have a dual option with a copay-based plan and an HSA eligible plan. We can absolutely offer the gap benefits just to those enrolling on that copay plan. You know, we can also offer multiple group gap levels on the same plan. So for example, if we have a 6,500 100% plan, we're able to offer a $2,500 gap plan as well as a $5,000 gap plan. So we need to have at least 5 people in each plan to do a dual option. And one of the most exciting things that we offer as a dual option is an employer-paid inpatient only plan. And a lot of times we sell that with a $2,500 benefit. And what that does is that allows the employer to get 100% participation on the gap plan. He can offer his employees a $2,500 inpatient admission benefit, and we can set it up as a dual option. So if people want to purchase, let's say, $4,000 deductible gap or a $4,000 benefit gap plan that would cover in and outpatient services, they're able to voluntarily pay that price difference. You know, and most of the time we can get that inpatient only plan for around $20 a month. So what we're showing you here is an example of how the group gap plan works. So with this particular example, this group was looking at a renewal increase of well over $100 per month per employee. And what we did is we increased their deductible to $2,500 up from $1,500, and they were able to see enough savings in premium that we could implement our group's gap strategy with a full $2,500 zero deductible benefit. So we were actually able to provide a greater benefit than their deductible increase. So we actually lowered the overall out-of-pocket expense and cut the renewal cost to $572 overall. So again, this is a great example how you can help your clients and offer them a more competitive renewal opportunity. So one of the things that we can do is a few months ago, groups were not able to absorb a 20% rate increase. And now that has completely changed in today's world. And group gap is a fantastic option, whether you can bundle that with us or another carrier to help keep that employer's financial exposure and keep the employee's max out of pocket down. So the third product that we want to offer is called Evolution, and this product is a group accident and critical illness product. And as you can see here, this product is available for groups of at least 2 enrolling, and we have a ton of flexibility when it comes to considering a new group with our Evolution product. It is a guarantee issue, and unlike the group gap plan, it does not coordinate with a medical plan. So we're able to offer this to everybody employed on a particular group, whether or not they have a group medical plan, of course, and whether or not they're actually participating in that group medical plan.
So John, who's in the market for this type of product?
So a lot of the employers that have a strong interest in this product are employers that are offering, let's say, a management carve-out. but they've got an hourly staff or a warehouse staff that they're not offering full medical benefits to. Due to the cost, we're able to put that employer in a position where they're able to offer something of value to their employees and also help lessen the cost for those on the carve-out plan. Also companies that see high turnover or potentially lower wage and a huge amount of hourly employees, there's a ton of value with this product. So think of industries like home health care, nursing homes, restaurants, even trucking companies where they might have a higher concentration of 1099 employees. This is a product that can fit for everybody. Currently, this product is available in 25 states, and within the next 30 to 60 days, we should have a variation of this product available in almost every state. So exciting times coming up. We've added some states on SFC. We're adding some states here on Evolution. So we've got a lot of good news here going into the summer that's definitely going to help you out in fourth quarter. With regard to some of the benefits on the plan, one thing that I really want to drive home for you today is these are per accident benefits. So keep that in mind. So if your child gets hurt playing sports, and keep in mind that's another thing that we do provide coverage for youth, middle school and high school, even professional sports, we can extend coverage to. If your child gets hurt playing sports and they get hurt later in the season, these are per accident benefits. So it's a great opportunity for a member to maximize their cost savings by purchasing the Evolution product. And as you can see here, we actually have some standardized plan options available, ranging from an accident-only plan all the way up to our hospital care 1500, which has accident, critical illness, and a hospital admission benefit. And one thing that I want to know is that if a group does have an ACA medical plan, obviously with that, we are, a medical carrier is covering a yearly physical at 100%. If you have that yearly physical, that preventative service done, we're going to pay that member $50 for getting something that is covered by the medical plan at 100%. So it's a great benefit across the board on every Evolution product.
John, can you share some pricing with us, maybe on the low end accident care 1000 and maybe the hospital 2500?
Yeah, absolutely. We're going to discuss employer paid options because that's what we see a lot of employers wanting to do. Once they see the price, they're able to say, you know what, I can float that amount and I can give something to every one of my employees. And in Ohio, for example, where I'm located, the accident care 1000 benefit is $3.93 per employee. To give you guys a little bit of a regional difference, South Carolina for that same plan is $4.91. And to go up to that higher option, the hospital care 1500, in Ohio, that plan is $21.59 an employee. And in South Carolina, again, that is $21.93. So your rates are going to vary a little bit state to state, but we can also sell this as a partially employer paid plan as well as a fully voluntary plan. And one thing that I want to point out is how the Evolution product can work with some of our other products like the group gap plan. So one item that we discussed on the Link product or group gap plan was having that $2,500 inpatient only benefit. So again, in Ohio, the inpatient only plan on the group gap plan is $11.95. So for a $2,500 inpatient hospitalization plan and a $1,000 accident benefit, which was coming in at $393, you can get both of these plans for under $16 per employee on an employer paid basis. So this is an outstanding way for you to add a ton of value to your employer's medical plan and for the employer to come in and actually add valuable benefits. And keep in mind that $2,500 inpatient only plan, there's no deductible on that. So these are going to be first dollar benefits that these members are going to see, and it makes everyone come out ahead here. You, the broker, the employer, and the employees, everybody's a winner. And as you can see here, this is an example about how a group can incorporate this into their benefit package. And by looking at adjusting the medical plan, currently this group is doing a carve out. We can look to increase the out-of-pocket expense on the medical plan and bundle this in to that particular plan. This also allows us to cover those multiple classes of employees. And in this example, they've broken up the carve out into their management and supervisors and their wait staff at this restaurant. So by adding evolution, we've provided the employer with a benefit that can help his management staff lower their out-of-pocket expenses on the medical, but we've also provided that paid benefit across the board to every employee, not just those on the full medical plan.
So John, what's the enrollment like for this product?
So the enrollment on Evolution is very quick, it's very easy. We do offer census enrollment, and we really need an employer application. We can pay by check or we can pay by ACH, which is preferred, but that's it. That's how quick and easy this enrollment process is.
This is a great solution for our employers out there today that are not able to pay benefits for furloughed employees or employees that are going to be losing their hours down to a minimum. There's a lot of companies that have to reduce the workforce and terminate employees. This is an option that is less expensive than keeping them on the plan that can still give them some benefits.
Exactly. It's all about creating value for your employers, and this is a great way to do it. So the next product I want to discuss with you today is our group dental product. And this is available for groups 2 and up. And as you look at the benefits shown here, there's a couple of things that I want to mention to you. The first thing is that we can do that voluntary or employer paid, and there's actually no change in rates depending on the contribution amount. So we do have some plan flexibility in terms of moving things like endo and perio into basic, out of major, and we can also waive waiting periods for those on a prior group dental plan. We can also offer a very rich benefit of up to $5,000 for your year maximum.
And what other deductible options do you have besides the $5,000, John?
So we have all the way down to $750, and then we can all go up to $1,000, $1,500, $2,500, and $3,500. And currently, the dental product is available in 47 states, and 3 of those states are indemnity only. So in our PPO states, we do use Aetna Dental Access, and we can offer that on a MAC chassis or on a more traditional 80th or 90th percentile UCR. In the states that we do have indemnity options available, we do have that same 80th and 90th percentile UCR reimbursement level. The last set of products that we want to review with you today are our life and disability products through IHC. These are underwritten by Madison National Life, a wholly owned member of the IHC group. And in terms of group size, our life and STD products can go down to a group size of 2. Long-term disability does need at least 5 to enroll, and we are able to offer custom plans as well as match up an employer's current benefits.
And does that be employer paid, or can it be a voluntary product?
So groups under 5 do need to be 100% employer paid. Now, if we get at least 10 eligible, we are able to start offering those partially employer paid benefits as well as voluntary benefits. So it's going to vary depending on group size. But for voluntary benefits, for example, we need at least 10 eligible, and we need the greater of at least 10 enrolling or 25% participation. So obviously, the bigger your group is, we're going to need more people participating on the plan. And we also have a true worksite product that we can discuss with you on a case-by-case basis. Currently, we have our life and disability products, or at least a variation of those, available in every state except New York. And Kim, I believe you had some updates about Montana.
We do. Montana has just been approved for all lines of business with Madison. Awesome. One thing to really keep in mind is that you can't buy auto insurance after you had an auto accident. You can't buy homeowner insurance when your house is on fire. You can't buy life insurance after someone's passed away. We all know that sometimes that's a really hard conversation to have with an employer. The life insurance is the cheapest benefit employer can offer that gives the biggest payout. And again, these products can be offered on a voluntary basis. So just by offering them and letting the employees buy it, it would be a huge benefit for these employers.
Awesome. And one of the things that we'd like to discuss with you today are our producer resources. And Kim and I want to encourage you to use us as your first line of resources. We are here to help you in terms of sales, service, claim issues. We want to be that primary point of contact and give you that elevated level of service that a lot of carriers might not provide. We know a lot of carriers out there. When you call their rep, here's a 1-800 number. Go ahead, see what you can find out. Let me know if you have any issues. Kim and I want to stress that we are here to help you. We are here to be a resource, and we want to engage with you to make your groups run even smoother. And with that said, we do have a great website that offers a very high level of information. Right here is the web address. So if you want to take a moment to write that down, go ahead and do so. And through the Group Resource Center, you're going to be able to download a couple things like a plan brochure, a state availability map if you're working in multiple states. And we also, again, want to reiterate, we want to be your primary point of contact. So although through this website, you can click Get a Quote, and you'll be able to put together an email with information or additional questions. That'll come direct to IHC. We'll assign that to either Kim or myself. We want to stress that our contact information is going to be on here. Take that down, send it to us, let us engage with you.
John, I tell agents every day that I work with that IHC has something for everyone. It may not be exactly what you came in looking for, but we have solutions for your groups. We can do both the group and individual. We didn't hit much on our individual products today, but we do have tons of resource on the individual side, including our short-term medical bundled with our health discount plan, which includes the teledoc. So please reach out to your IHC representative, your upline. John and I are always here. If you have any questions or any ideas or you need a solution, we can help you with that.
Exactly. And again, as we discussed, Kim's contact information is here. My contact information is here. Again, we want to be your primary resource for new business sales and service. So let us know what we can do to help you out. And without further ado, we want to see if there are any questions for you out in the marketplace.
And one last thing, if you have an IHC contact already that you're working with, please filter your questions back to them and they will reach out to their IHC rep. So if you're already working a channel with IHC, please continue to work that. I'm sure you're getting great service, but continue to do that. We had some great questions come in, wanted to kind of address them. One, few questions on the size for the small group level funded. 5 to 7 enrolled lives is what we can do. In terms of how is the fund limit calculated? I'm assuming that means the claim fund. We are going to base that claim fund on 120% of expectation. The idea is for you to get money back as the employer. So we're going to fund that claim account with 120% of expected claims. Another question was, is there a specific stop loss per employee? Yes, we run a spec and ag program. So depending on your group size, we'll determine your spec starting out at 15, going as high as 35. Had a question from Gina about the GAP plan. Why would an employer give a 0% out of pocket to the employees? Wouldn't that cause employees to overutilize their plan and cause a self-funded rate to increase? The self-funded plan and the GAP are not tied to each other. So if you're having somebody overutilize their GAP plan, it does not affect their SSD plan. So obviously we have variations of options for that. We see very few people actually gapping 100% of the out-of-pocket. We see a lot of people putting $100 or $1,000 deductible on there and then gapping maybe the increase of what they had to get the premium down, $1,000 or $2,000. So we have the option, but usually it's not used as much as we see it in other markets. Well, that has concluded our 35-minute presentation. Thank you all very much for attending. Again, reach out to your IHC representative. If you don't have one, please feel free to give John or myself a call, and we will assist you. We look forward to working with you all. Thanks, and have a great day, and stay safe out there.